Hello, Dr. Lou, David, and Ashley. Thank you guys for watching our video. And my name is Gordon Chang, and I'm going to start us off with our BME 111 final project. So, as you guys might be able to tell from the first slide that you just saw there, our device choice is dental implants. And in terms of our material choices, we chose titanium and zirconia, which are both very popular when it comes to making dental implants. So, I'll talk really briefly about chemical composition and physical structure. In terms of titanium, its chemical composition is it's just mostly titanium, but there's also some other elements thrown in there, such as oxygen and carbon. In terms of zirconia, its chemical composition is going to be primarily this ZrO2, this zirconium oxide, essentially. But there's also some other metal oxides that are thrown in there as well as, one of the example would be yttrium oxide. In terms of its physical structure, titanium is a little less dense than zirconia. However, zirconia is a better thermal insulator. So basically what that means is that zirconia would be a little better than titanium when it comes to resisting heat transfer. And in terms of its actual structure, titanium will form these hexagonal closed packed crystal lattice and a body-centered cubic. At sort of varying temperatures, the structure kind of changes between those two. While zirconia has a crystalline structure and it's got essentially three chemical forms, which is tetragonal, monoclinic, and cubic. So as you can see here, I was able to find some images on both of these sort of dental implants, and I've decided to put them side by side for your guys' reference.
So here on the bottom right, we have a comparison of the mechanical properties of titanium and zirconia. We can see that titanium has a higher tensile strength and it also has high yield strength and is very resistant to wear and tear. However, when it does degrade, it can lead to particles in your mouth, and it can also have a stress shielding effect on the surrounding bones. Now, I was unable to find the stress strain curve of the specific kind of zirconia that's used in dental implants, which is Ytteria stabilized zirconia. But here on the right is the stress strain curve of titanium. Zirconia is lower in strength, but it's still strong. It has high fracture toughness and a significantly higher hardness than titanium. Its downside is, however, that it's very brittle. Both of these materials are reliable options for dental implants, and the main difference basically comes down to cosmetic concerns.
I'll be talking about degradation mechanisms of titanium dental implants. Titanium naturally forms an oxide layer that resists corrosion, although crevice corrosion begins when damage occurs. Damage can happen from manufacturing defects as well as chemical attacks from low pH. The internal cracks can be seen in cross sections in Figure 5. Moving on to zirconia. Zirconia has a phase change which is triggered by the moisture in our saliva. This transformation has a 4% volume expansion which causes microcracking, surface roughening, and grain pullout, which can be seen in the picture above. The monolithic phase percent versus aging time in dental implants can be seen below. For timescale titanium implant degradation, an ion release study happened where it shows pH 3 saliva has very little titanium released at 12 months, with little to none for a neutral pH. The degradation rate is less than 1 nanometer per year in acidic environments. Overall, it's very stable unless physically compromised. The ion release studies can be seen in Table 2. For zirconia, it's surface limited, and the mechanical properties remain stable even after 3,100 hours and has great long-term performance. Specific mechanical properties versus aging time can be seen in tables 3 and 5.
Some of titanium's surface properties, mechanically it's a very tough substance. It can take high stresses repeatedly over long periods of time. Chemically, it's very corrosion resistant. It actually forms a chemically inert, self-renewing titanium oxide layer on the surface when exposed to oxygen. And this makes it resistant to electrical, pH, and biological changes. Generally, it has a high surface energy, which makes it more hydrophilic. Zirconia, on the other hand, is also very tough, but it's actually more corrosion resistant than titanium. It also forms a non-conductive, chemically inert zirconium oxide layer on the surface. And generally, it has a lower surface energy, which means it's a little bit more hydrophobic, and that makes it a little bit more inert. So cellularly, titanium undergoes osseointegration, which is when bone cells attach to the surface. The most important factor here is surface roughness. Basically, the more varied the surface area is, the tighter that bone cells can come in and bind to it. However, this tighter interaction does lead to a greater chance of inflammation. Zirconia, on the other hand, is known to be bioinert, which means it does not react chemically with tissues. However, we can use surface treatments like UV and acid washes to make it roughly similar with respect to the bone integration. So it is bioinert, which means it has better bacterial resistance, which leads to less inflammation, and it is a hypoallergenic product.
Thank you. And now I'll be going over the challenges of both materials. One of the drawbacks of titanium are the aesthetic limitations. On the image on the top right, you can see how prominently the implant can show through the gum line. Patients also report a temporary metallic taste after implantation. It can last for a few weeks. Second challenge with titanium is periimplantitis, which is a buildup of bacteria that can lead to poor outcomes and in some cases require implant removal. Titanium particles are released by the implant and can cause a foreign body response. Macrophages ingest the titanium particles through phagocytosis and release pro-inflammatory factors like IL-6 and TNF-alpha. Further along in the foreign body response, fibroblasts create more areas where bacteria can form. As for zirconia, cost is the biggest factor. Titanium implants range from $975 to $5,000, while zirconia is $1,500 to $7,000 without insurance. Alongside the increased cost, zirconia is harder or makes it more difficult to mill during the manufacturing process. And during implantation, dentists have a difficult time tweaking the implant to ensure a proper fit in the patient's mouth. From our research, we came up with some ideas that can improve on those drawbacks. For titanium, a surface coating can be made that can both color match to the gums and release a controlled amount of anti-inflammatory compound like IL-10 to reduce the inflammation. As for zirconia, an AI-aided adaptive system that is able to scan and create files from the patient's dental x-ray that can then 3D print the implant and reduce material waste, and can also reduce the need for small adjustments during the implantation process. Thank you for listening, and here are our references.